Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and today's video is part 6 of our 7-part series on how to treat wrist tendonitis. If you have missed any of the last 5 parts of this series, you can see them on my channel in the playlist, or you can also see them, I'm going to post them in the description below. So check those out. And in today's video, we are going to be talking about pain and edema management. So that is something very important to deal with your patients, because why are they coming to you? Because they have pain. Let's get into it. So with the way that I see treating wrist tendonitis, we know that this takes a very long time to heal. So you're not going to be with the patient every step of the way. You're not going to follow them for 9 to 12 months, 12 to 16 months. You're not going to be at home with them. And they are going to experience pain at some level throughout the healing process. So I truly believe that pain management is something that we teach our patients how to do for themselves. It's the whole idea of therapy is not a place you go, it's a thing that you do. So I think it's super important to teach your patients self-management strategies and not have them necessarily rely on you for providing their pain management. So what are some things that we can do to help with pain and with swelling that we can teach our patients how to do at home? So first things first, you can recommend hot and cold modalities for these patients. So it might be time to review your PAMS courses or any material that you have. Make sure you take into consideration the precautions and the contraindications so that you can provide education about these modalities and how to perform them safely at home for your patients. In an acute case, so for example, the first month of onset of symptoms, I am typically recommending ice for these patients, or cold pack, something to help with inflammation. We don't want to completely stop the inflammatory process because that's how things heal. However, we do want to control how much inflammation is in the area. It will also help relieve some pain and make sure that you're not having people with so much swelling that it leaves scar tissue behind in those areas in a long-lasting way. So typically I'll recommend that people use ice, 2 or 3 times a day, 10 to 15 minutes. Make sure that they check their skin frequently so that, especially if they don't have good sensation of their fingertips or their hands and they can't feel very well, but they can put ice on that area, have a pillowcase that you put in between, simple enough. After that first month, we're kind of moving into a more chronic phase of inflammation at that point, and really you want to help stimulate circulation and blood flow to the tendons. We want to help to lengthen the tissues, and so heat can also be applied at that time. That doesn't mean that they can only use heat and never ice. I do think that because we are active with our hands and our wrists throughout the day, they will have inflammation that kind of comes up throughout the day. So ice can still be a helpful modality, but you can also have them start to apply some heat with a hot pack, a heating pad, warm water soaks, paraffin unit, whatever they have at home that they're able to do. Again, I typically recommend heat for 15 to 20 minutes or so, 2 to 3 times a day, and make sure that they check their skin frequently to ensure that they're not causing burns of the skin. So both of those can be helpful things that your patients can do at home. And typically with heat, I'm advising them to apply that more along kind of the muscle belly of the injured tendon rather than directly at the tendon site. I think that it does help with just tissue lengthening overall, improving circulation and reducing tension. So I usually will refer or recommend patients to use ice kind of more on the actual tendinous area and then more heat kind of up towards the muscle bellies. Let me know if that's something that you guys tend to do as well, or other therapists watching if that's something that you tend to recommend. Another thing that I typically do is teach patients how to do self-mobilization techniques at home. I just like to educate patients that I want you to be able to replicate what we're doing here at home to help you heal. So I can't be with you every week and you need to find a way that you're going to be able to replicate what feels good and what helps with your pain at home. You can give them the suggestion of using a small ball to roll kind of the muscles of the hand if they're having some pain through the hand. Most often with wrist tendonitis, their pain is going to be kind of up the forearm on either side. So get a couple of tennis balls, put them in a sock, and then they can kind of roll back and forth on a table. That's something that they can easily do if they have a partner, a spouse, or a family member that's willing to do some massage for them. That's also totally fine. But you want to give them techniques that they can replicate at home. And if they do feel like they need massage, professional techniques, and from a massage therapist, then you can recommend them to do that. That's something that they can certainly do, and it might feel really helpful for them. So yeah, that's kind of my take on soft tissue mobilization, deep tissue mobilization. I really like to empower my patients to be able to do things at home versus passive treatments. I think that is much more beneficial in the long term. And another good strategy that you can use to assist with pain is doing kinesiology taping. So that's also something that you can look into. There are quite a few good instructors out there and a lot of good content. I would highly recommend finding an instructor who is certified in the application of taping method. I hope this video was helpful. Those are some of the techniques that I use in my practice to help patients, empower patients to do pain and edema management, self-management strategies at home. I think that is crucial. I think they're going to use these techniques, and they need to have something in their toolbox that they can take out when they are experiencing pain. You can't expect somebody to come to you for 5 to 6 weeks of visits consistently, and you're helping them with their pain. They're just kind of a passive passenger. They're feeling better because you're doing certain techniques for them, and then they can't come back to therapy. And then what's going to happen is in a month or two, their pain is going to flare back up, and they're going to want to come back to you, where you can actually help them learn how to manage that at home and empower them to be able to take care of their body and listen to what their body is telling them, and also to provide for themselves what is going to be truly therapeutic at home. So that is my take on pain and edema management with wrist tendonitis. If you have other thoughts, comments, anything that you think I missed or anything that you think is worth discussing, I love learning new things, and so if you have anything to share, please do so in the comments. That way we can all learn and grow and develop our practice as hand therapists and really as good providers for our patients. I hope you guys enjoyed this video. If you did, please give me a thumbs up. And subscribe to the channel so that you never miss another hand therapy video again. And I will see you in the next one, which is going to be part 7 and the last part of our wrist tendonitis series. And it's going to be what everybody wants is the exercises and stretches. So stay tuned for that one, and thank you for watching. Bye.